Assalamualaikum. Good afternoon, everyone. Good afternoon, ACH. I would like to welcome you on my topic discussion for today, aseptic technique and medication administration. Okay, let's start. By the way, I had co-speaker today, Miss Jaisel, for the topics medication administration. Let's start for this lecture for today. I would like to start first for the aseptic technique. Okay, aseptic technique. Start. Be the change you're trying to create by the background. This is a general term involving practices that minimize the introduction of microorganisms to patients during what your patient care. Two categories of asepsis. Number one, general asepsis. Number two is your surgical asepsis. Poor adherence to aseptic techniques results in considerable morbidity and mortality. It is important that all healthcare facilities establish policies regarding procedures that require aseptic techniques. The scope, the surgical staff, ICU NICU, anesthesia, laboratory staff, nursing staff, and other medical staff. In aseptic technique, this includes your hand washing, surgical scrub, using various precautionary measures, your, what is that? Your PPE. The patient preparations, maintaining the sterile field, using safe operative technique, making small incisions, avoiding trauma to tissue and surrounding structures, and controlling bleeding. Maintaining a safer environment in the surgical procedure area. Procedures indicating aseptic techniques include, for the spelling, typographical error. Anyway, let's continue. Placement of peripheral cannulations during insertions of IV and intramuscular injection of medications, especially from multi-dose vial. Wound care during administrations of intravenous fluids, that's the meaning of IV. Vaginal labor, dialysis, urinary catheters, central line, and other training devices. Key processes for performing medical, non-surgical procedures with aseptic techniques. Techniques includes hand antisepsis and appropriate use of gloves. Skin antisepsis of the site of insertion of invasive devices. Using and maintaining sterile patient care equipment. the multi-dose medication vials, IV fluids, and devices. The introduction of sterile item into a patient should always be performed with a no-touch technique. No touch. This means that the skin in the area of insertion should not be touched after skin antisepsis. Minimize risk of transmissions of pathogen. The top 10 tips. Okay. Minimize risk of transmissions of pathogens to susceptible sites and persons. Clean surfaces that sterile facts are to be placed upon. Ensure all fluids and materials used are sterile and check sterile packs for evidence of damage or moisture penetration. Hand contamination. Use sterile gloves if susceptible body sites are likely to be touched. Use maximal sterile barriers precautions for the insertions of central venous access devices. Ensure contaminated non-sterile items are not placed in the sterile field. Again, ensure contaminated non-sterile items are not placed in the sterile field. Do not reuse single-use items, even on the same patients. Do not continue to use sterile items if they become contaminated during the procedure. Reduce activity in the immediate vicinity of the area in which the procedure is to be performed to reduce the risk. And there is a recommendations for preparing hands and skin during procedures requiring aseptic techniques. This is the tabulations, the procedures, the example. The acronym H is hand hygiene, the PP, and the preparation of the skin. Insertion of peripheral IV catheter. For example is IV therapy. Then routine hand wash and disposable non-sterile gloves. That is one you will use. Then preparation of skin antiseptic. Preparations of IV fluids, medications, mixings of IV fluids and medication. Example, and then as usual, your routine hand hygiene and non-sterile gloves. Then and preparation not applicable. Why? Because this is only preparation of IV fluids, medication. Administration of for injection medications. Examples are IV injections. Same as above. Hand wash, non-sterile gloves, and then antiseptic. Insertion of a central venous catheter. The chemotherapy line in adults, we don't have chemotherapy here, but umbilical artery catheter in neonates is the one applicable for us in our healthcare facility. Chemotherapy, no. Anyway, for the awareness of it, it's included. Antiseptic hand wash and antiseptic hand rub. What does it mean? Hand wash using soap and water. Hand rub using your alcohol gel. Okay, next. Sterile gloves recommended. Your gown, then your eye protection. And then antiseptics is the preparations of skin. Collections of body fluids from sterile body sites. Spinal tap thoracentesis and abdominal paracentesis is the example. Hand antisepsis. Then sterile gloves, gown, and eye protection. And then antiseptic. Procedures that come in contact with mucous membrane. Bronchoscopy, the example, endoscopy, tracheal suction, and then urinary tract catheterization. Then hand antisepsis, and your PPE is your non-sterile gloves. And preparation skin, not required. Mild soap, water, cleanse urethral mucus skin, sufficient. And this is for the aseptic technique. Okay, so our next subject is our medication administration. So I will continue this. For the continuation. The new stuff that I do orientation for yesterday not come. I'm waiting for her. Anyway, to be continued for another topic. Okay. Medication administration. Start with myself. And first medication is 950. Start. My exact dose. When you're doing medication, preparation, administration, it must be what? My exact dose. Exact dose. Start. The objectives. Enhance the knowledge of the participants regarding pharmacological computation. And at the end of these slides, there is some questions nurses to be answered, should be answered. Facilitate a quick review on medication administration. Promote a safe nursing practice when it comes to medications, preparation, and administration through proper education. Again, promote a safe nursing practice when it comes to medications, preparation, and administration through proper education. And this is our sample picture. Medication error statistics. More people die in given year as a result of medical errors than from motor vehicle accidents. Okay. Breast cancer or AIDS. It was said more people die in a given year because of the result of medical errors. Medication errors alone occurring either or in or out of the hospital are estimated to account for 7,000 deaths annually. Adverse drug events cause more 770,000 injury deaths each year, cost up to 5 million per hospital. Patients who suffer unintended drug events remain in the hospital an average of at 8 to 12 days longer than patients who did not experience such mistakes. You see, that's needle, your needle, needle. Medication error statistics. Infusion devices account for up to 35% of all medication errors that result in significant harm. The most common errors are manually programming correct infusions parameters, failure to ensure the right patient receives the right medication, and tampering of infusion parameters by unauthorized users. The prescriptions. Question. If you did for the prescription clarification, ask your doctor. If you did not understand, inform and ask your doctor regarding the doctor's order written on what in the prescription. You can ask your doctor. Okay. Name, it should have name of the drug, dosage, route of administration, right patient, right route, right drug, right dose, and right administration. Time of administration, the frequency, and this your parenteral administration. See, not all of you are, I know some of you are afraid of giving injection, even me. Introduction for our parenteral drug administration can be taken literally to mean any non-oral means of a drug administration, but it is generally interpreted as relating to injection directly into the body, bypassing the skin and mucous membranes. The common routes of parenteral administration are intramuscular, subcutaneous, and intradermal. And IV. Intradermal, how many degree? Can you are giving intradermal? 15. Sub-Q, 45. How about the intramuscular? IM, 90. intradermal route, subcutaneous route, intramuscular route, tenure, intravenous route, tenure conversion, pharmacology computation, units of measurement, metric system, SI units, imperial system, domestic equivalents, international decimal system of weights and measured based on the meter for length and a kilogram for mass, originally adopted in France in 1795. Oh, this is the prefix symbol, decimal, iota, zeta, hexa, beta, tera, giga, mega, kilo, hecto, deca, and meter. Metric system, convert 1,000 milligram to kilogram. 0.222589 cm to meter. 1,4589651 kilogram to gram. 89564 to kilometer. 0.897 214,752 cm. The imperial units or the imperial system is a collection of English units first defined in the Weights and Measures Act of 1824, later refined until 1959 and reduced. Imperial system, 60 grains equals 1 drachm, 8 drachms 1 ounce, 1 pound 7,000 grains. In volume, 1 fluid drachm 60 millims, 1 fluid ounce 8 fluid drachms, 1 pin 20 fluid ounces, 1 quart 2 points, 1 gallon 4 quarts. 1 foot equals 12 inches, 1 yard equals 3 feet, and 1 yard equals 36 inches. Imperial system. Convert 36 inches to feet, 25 yards to inches, 8 ounces to grams, 25 pounds to ounces. Metric in imperial system. 1 kilogram to 2.2 pounds, 1 grain 60 milligram, 1 grain 15 grains, 1 ml 15 minutes, 1 pounds 454 grams, 1 fluid ounce, 1 fluid drachm, 1 pint and 600 ml, 1 liter 35 fluid ounce, and 1 foot 30.5 centimeter. 1 is 2.54 cm and 1 yard 0.9 meter. Just a minute. Their domestic equivalents: 1 teaspoon 5 ml, 1 tablespoon 15 ml, 1 dessert spoon 7 ml, 1 teacup full 150 ml, and 1 thumb Therefore, 250 ml. IV fluids in calculations. Formula: drop per minute, volume to be infused times drop factor, number of hours to be infused times 60. This is the formula. And then flow rate, volume to be infused to number of hours. Okay. This is the example question. And then I will ask you what's the answer of this. 1 liter of normal saline solution was ordered to a patient admitted in a female medical surgical ward for 8 hours. How many ml per hour would you give? Drops per minute. That's the first question is how many ml per hour would give drops. The second question is drops per minute. And how many bottles of fluids will she consume for 24 hours? So three answers. Right on the dashboard you can. And then D5, 500, D5 water, 500 ml to be infused with a rate of KBO. What's KBO? Keep vein open. Was ordered to your patient. You started the fluid at 7, uh, this is 7 a.m., 7 p.m. So, what time it will be finished? We will come back for this question. And this is the formula. Desired dose times quantity divided by stock dose, the ratio and proportion. And this is the question again. Calculating is for the following. 100 milligram of methylprednisolone is ordered for patient having an asthma attack in ER to be given IV stat. The stock on hand is 250 milligram divided by 2 ml. How many will add 250 milligram per 2 ml, not divided. How many ml will you give? It means dosage uh, over stocks. Subtraction 1 gram IM every 12 hours was ordered by the doctor. The available dose in the pharmacy is 500 milligram per 2 ml. How many vials of medication will the patient consume for 24 hours? You will answer this. Okay. For this question, can be expressed by milligram per ml, percentage. The formula dopamine and dobutamine. Formula flow rate, micrograms per kilogram per minutes concentration, divided by concentration. Doctor's orders is 5 microgram per kilogram per minute. Patient weights 132 pounds. Your stock dose is 200 milligram per 5 ml. Okay. Just use the flow rates, the formula micrograms per kilogram per minutes divided by concentrations. And thank you for this, but we will come back for the question. Ask who is the one who will answer this. Mhm. Regarding the questions, the one with 100 milligram, I will write 100 milligram. Doctor's order divided by stock dose, the one that I had in the question. 100 milligram, doctor's order, and the stock dose is 250. Divided by 250, then times 2 ml. The answer is 0.8. Yes. And the other one, regarding the questions of this one, the 1 gram, this is 1000 divided by 8 hours times 15 drops. Sorry, 1000 times 15 drops divided by 8 hours times 60 is constant. How many drops will be? 31 drops per minute. Okay. So for the medications administration, you must know the rules, the right dose, right row, right patient. First, the right patient, right dose, right row, right drug, right administrations. And this is our topic for today. Uh, and the next will be uh, Q&A, maybe on the next discussion. Q&A, question and answer regarding our survey questions. What is the important that we need to be focused during survey questions? And I have here given by I see in the group. I will share it to you. Again, the one I did, drops volume times drop factor, number of hours to be infused times 60. And this is our lecture for today. And thank you. See you on my next topic discussion. With I will be with the Corazon again for our multi-drug resistant organisms. Inshallah. And we will discuss this also. Thank you for watching.